Belize and the rest of the Caribbean are well in line with the global trend towards smaller families. It is a reflection of the reproductive choices taken to determine the spacing and number of children. Those choices are determined through educational, labor, health, and economic policies that enhance options. Across this region and the world, on average, the fertility trend is that there are 2.6 children per couple, a figure which has reduced over the years.
If you talk about the countries with high fertility rate, those countries normally the population face lack of access to sexual and reproductive health services, lack of education, lack of access to comprehensive sexuality education, gender imbalances that limit women to choose the number of children that they would like to have. So those in countries with and also policies that in some cases don't enable them to have the right to choose. And then you have those countries with low fertility rates where you can see that it's very difficult for many couples and women to make a balance between career and having children. Also because childcare is very expensive, so they cannot afford to have more children. And also because in these countries the delay of maternity.
The State of the World Population 2018 report by the United Nations Population Fund was officially launched today. The report, entitled The Power of Choice, focused primarily on reproductive rights and the demographic transition, highlighting that the power to choose the number, timing, and spacing of children can bolster economic and social development.
It's highlighting how within a country you have those type of situations and how some countries are facing issues related to and challenges related to high fertility rates, and other countries with low fertility rates, they are also facing challenges. The region is in a situation that it can go to the situation where it's below replacement levels, so then it can become an issue. But while the fertility trends is very in line with the global trends, the adolescent fertility rate is still high, and in some countries very high. So the average for the Caribbean is 60.
With that glaring statistic, the UNFPA has been working with governments to develop policy and support awareness initiatives. In Belize, the data is a little higher, where 74 per every 1,000 children are captured in the teenage pregnancy category. To address this issue, the Ministry of Health has been working with the Ministry of Education and other agencies to provide access to information and proper family planning, sexual reproduction health, and more. Dr. Natalia Larga-Espada-Bear is the Maternal and Child Health Technical Advisor to the Ministry of Health in Belize. The statistics were recently released in a national consultation on the health of adolescents.
Adolescent birth rate play a role, especially for us in Belize, since it is still high, in contributing to this total fertility rate. It's a complex indicator that is linked to economic and social factors, social determinants, where the issue is, the issue highlighted in the report is the issue of choice. We have currently, in the last years, 1,400, 1,500 girls delivering before completing 20 years of age. So we call that adolescent moms. In the ideal world, no adolescent should be having kids. But we have, on the other hand, the law where, with parental consent up to the age of 16, girls can consent to marry, and the parents can consent for marriage. We have the Ministry of Education providing the services within schools through the Health and Family Life Education. We have the Belize Family Life Association. They are providing comprehensive sexuality education and services to adolescents. They are not countrywide. I think they are working in 4 districts. But we definitely need to improve the coverage of services providing information and commodities to adolescents.
The UNFPA Belize has been working with government since 2003 and supports with ensuring that men, women, and children can exercise their reproductive rights. Currently, a national comprehensive adolescent health strategy is being developed.
In addition to supporting with advocacy and policy support, there is support for capacity building. There is support for the procurement of the necessary contraceptives to be able to make those accessible. In the past, we've supported with the care protocols for maternal care. So the support that is given is actually wide and is guided by what the priorities of the Ministry of Health are. More recently and during the course of this year, there's a lot of prioritization of adolescent health, and so this is where most of our support is going now in the development of the strategy. We're conducting currently an assessment of the provision of sexual and reproductive health services and information to young people as well as marginalized groups, which would include even those persons with disabilities.
Duane, Moody for News 5.